I'm Kathy Knight with the Department of Nutrition and Hospitality Management at the University of Mississippi, and I have the honor of moderating the breakout session today. And I thought first I'll just refresh our memories a little bit about the speakers and their topics. And we have Dr. Sarah Gable from the Department of Nutrition and Exercise Physiology at the University of Missouri, Columbia, and she spoke to us about evidence from a longitudinal study of America's children. We have Dr. Scott Owens from the Department of Health, Exercise Science, and Recreation Administration at the University of Mississippi, and he spoke to us about preventing obesity, physical activity interventions in public school settings. And Dr. Sarah Colby from the Department of Nutrition at the University of Tennessee, Knoxville, spoke to us about iCook 4-H, increasing culinary competence and family mealtime of youth and adults. Dr. Barkin from Vanderbilt was not able to make it at this session, and she left me her email address, and she said that anybody, I could give it out to anybody who wanted it, and so I'm not going to advertise it like over the live feed, but anybody who wants Dr. Barkin's email address, please see me after the session, and I'll be glad to give it to you. So, having said that, any questions? Yes. Oh, I'm sorry. You know what? We also have Aviva from the University of Florida, who is going to go among you with a microphone. And I think what I'm going to do, since I really do not need a microphone, I think I'm going to let Aviva have my microphone. So she's going to take that, and I can talk like this. How about that?
Judy Warren from Texas A&M. And I'd like to ask Sarah a little more about the mental health issues that you uncovered. And can you just elaborate a bit more about any sources of those mental health issues that perhaps you all were able to look at?
So I should probably talk into this. So the thing to keep in mind is that the measures that were used were teacher reports of behaviors that they had observed. So as far as, and I always like to qualify this because I think it is important. These are behaviors that teachers observed. Where they fall on that continuum of turning over into a mental health issue, we don't know. We don't know. But the thing that I think is probably, to me, just the way I think about the subject in that developmental period, I do believe that children are having the experience, children in the obese category and the overweight category, particularly the persistently obese, are having the experience of being a member of a group that's stigmatized. And that is a very stressful position to have. And one of the things that we know about obesity, and this is Kelly Brownell's work, used to be at the Rudd Center at Yale and now he's at Duke. One of the things about obesity is a stigmatizing condition that distinguishes it from other conditions that might be stigmatizing or marginalizing, is that the average person looks at an individual who's overweight or obese and blames it on them. And so that is a very distinctive feature of obesity as a stigmatizing condition, because the individual who has it, and I'm not talking about that person or that person or that, I'm talking about in general, the global idea of being a person with a weight problem. People think you're at fault. It's your fault, and so when that means one thing in an adult, and it kind of means something different for a child, because I can't remember who said it yesterday, but children, there's this intermediate level for children when it comes to nutrition, what they eat, and their physical activity opportunities. And, they rely on a lot of other people. And so, but then if they're feeling to blame for their condition, and which you can't hide, can't run and you can't hide, when this is your stigmatizing condition, I do think that feeds into this developing sense of self that, to use the expression, the self-fulfilling prophecy. U.S. society holds horrifically derogatory ideas about people with weight problems. I mean, we really do, and they're perpetuated. You know, you look at how they're perpetuated. Kelly Brownell's group has done some really nice work. It's older, but looking at the way overweight characters are portrayed in situation comedies and in movies and things like that. And so there's this, you know, it's incredibly pervasive. And so I think for children, you know, it's how do you take that in, and how does that feed into your developing sense of self? So not so much from a mental health perspective, but just that developing sense of self. If you are vulnerable to that, because I'm not saying all children who develop weight problems are going to develop this sense of self that becomes, you know, allies with these derogatory ideas, but for some children, they're possibly more vulnerable to that than others. So I don't know if that gets at what you're asking. Okay.
Is there any data about how teachers treat overweight students?
That's a really, I was actually anticipating that question today because it usually comes up. The reports about the children's interpersonal skills and intrapersonal functioning, the internalizing measures, were teacher reports. And when I was trying to get this published, one of the reviewers hit pretty hard the idea that we were not accounting for teacher bias in any way. And the fact is we couldn't. We didn't have data, secondary data. We had no way to account for teacher bias. But there is evidence, a researcher named Clark McCown, who did the stereotype consciousness research, he's a developmental psychologist, he did similar research about, but they were from children from different racial groups. And he actually assessed teacher expectations of child performance, and they were indeed linked to the children's racial backgrounds, and that in turn fed into how they treated the kids. And that was completely independent of what the children's academic abilities coming into the class. So we were not able to account for that, but you do kind of think these school-age kids are being they're open to what other people are thinking about them, and if they're in classrooms with teachers who maybe hold some bias against overweight individuals for whatever reason, children might be internalizing that too. So thank you for asking that. It's a conundrum with that data.
Yes.
Ed Frangillo, South Carolina. I just wanted to mention two other thoughts in relation to this. One is that Colleen Barry at Yale published in Milbank Quarterly, I don't know, 5 years ago maybe, a really useful study where she interviewed people throughout the United States about obesity and developed 7 narratives that she and her colleagues heard about obesity, ranging from blame the individual at one end to blaming society and industry at the other end. And then she did a quantitative study asking people which of these narratives best reflect what they think the causes are. And people were actually remarkably sort of multivariate about it. They knew that more than one reason was applicable. So I'm not discounting what you're saying, but I think also people are at least cognitively aware that there's multiple causes. Whether that affects their behavior and their behavior towards other children is a different issue. The other thing I wanted to share is that there's several studies that show that taller children, all other things being equal, do better in school. So if you think about that, why is that? Well, it probably has a little bit to do with teacher perceptions of children who are taller, maybe slightly more mature, because that is why they're taller. It's not explained, but it's just to point out there are subtle things that can happen with children that teachers pay attention to that then in turn affect child's performance. So it wouldn't be surprising if obesity is one of those.
Thank you. Anybody who wants to come in, if there's anybody out in the hall that wants to come on in, I started a little early. So.
Kristen Platt, Kentucky. I don't know if these data are out there, but I was curious, what is the perception of the parent of the obese child? Are they thinking, oh, they'll grow into this weight, it's no big deal, or are they thinking something needs to be done about this, what can I do?
I think it depends. and it can vary by culture as well. It's another important thing to recognize, and that to respect that and understand that, especially working with Latino culture, for instance, I'll use that as an example, to where a heavier child or a heavier baby is actually a preferable choice. It's something that you want, and it's something to be proud of. So if a practitioner comes in and says your child is overweight or your child is obese, there's especially if there's judgment around that reaction you have to be aware of that it is more than numbers on a scale. So the parents definitely, I know the research shows that many parents are unaware of where their child may be on that spectrum between overweight or obese, but the reaction that they may have to that information is very culturally specific, and also may have to do with their own family and personal background. So it really does depend.
Did you want to add anything? I agree completely with what Sarah has said, and I know that something came out recently. Do you get lots of email newsletters with titles of new papers and things? And I think that parents are having a more difficult time judging their child's weight, just the visual cue of that. And also, I don't know if you're familiar with The Weight of the Nation, the HBO documentary. There's something about this question in that. And I think it's the section about consequences for children, because they talk about, I use that material in the classes I teach because it was really well done, just little vignettes of it. But there's something about the low percentage of parents who actually seek help from their pediatricians on this. So your question's a really complicated one, definitely. It's very complicated because, I mean, calculating BMI is not something you just naturally do, and that's how researchers talk about it. So.
And the only other thing that I think is interesting, if you look at some qualitative research, when parents are discussing obesity and overweight obesity with children, that there's different verbalization. Very often they may talk about they, or those kids, and there's even if their child is overweight or obese and they're in a focus group setting, they're not going to personalize it as my child has this. It's very often they'll talk about a generalization of others. So even under those circumstances, it's seeing somebody on the outside. They're more comfortable.
Hi, Alexandra Pena, Ole Miss. So mine was kind of about the recess and exercise. Is there any research that shows that the way our school system is set up, for example, our 3-month gap of summer, does that cause a setback for the improvements that recess has shown?
I think it does. The Medical College of Georgia in Augusta, they have a prevention institution there, and they've done a number of child exercise and obesity studies. And one of the studies I remember that they did was a 2-year study, and they had data through 2 academic years, but they also had data over the summer months. And what they found was if you have an after school exercise program, you can, and during the academic year, you can show, compared to a control group that does normal activities, you can show that body composition, aerobic fitness can be improved with an after-school program. But what they found was the kids over the summer regress back to their starting points again, which suggests that kids are usually off 2 or 3 months, and you might think, well, during the summer they're probably very active anyway. But their data shows that there is regression back to their old baseline data over the summer months, and that physical activity has to be a 12-month affair. But they have shown that.
So I also had another question. Oh, if you.
Oh, I was just going to share, and I wish I could remember the names of who's been doing this work, and maybe somebody else can share it with us, that there are some programs where they're looking at taking the community schools that then would be closed down during that summertime and opening up the playground for community use to try to increase the physical activity, and that's one way that communities have responded. Some. There are other communities and schools that are worried about the liability issues and keep it locked down.
Tennessee actually passed a law to make it possible for the schools to get around those liability issues. So it's still up to the school district whether they want to open the facilities in the summer and after hours, but they knocked at least one of those barriers out of the way.
Mississippi did too.
The health department's bird program in the summers. The health department just had that summer bird program.
Can you get the microphone up?
I was just going to mention that the health department through the years has had the VERB program in the summer to keep physical activity going in the community. So it's community driven, not school driven, but it does help. Yeah.
So I'm a public policy major, and I was just wondering how, because you said the governments, federal, state, local, were all on board with putting recess and putting physical activity in the daily school routine. So what my question is seeing Mississippi education firsthand in elementary schools and kindergartens in Oxford, I was just wondering how does maybe Mississippi government, or how does the government in general justify giving all this time to physical activity when there's second graders who don't know their ABCs?
There's definitely a tension between trying to achieve academic excellence and trying to achieve some of the other goals we've been talking about at this conference. For example, in Mississippi, where I'm from, we do have a state mandate which says that children are supposed to get 150 minutes per week of physical activity instruction. And so it's a mandate, but it was unfunded. And so teachers, they're savvy about some of these issues and know that they're probably going to be judged on achievement scores, on tests, rather than whether this child's BMI, went up or down. And so there's a tension there, and I'm not sure how that's going to play out, actually.
I'd also like to respond. The only thing is we do have some research that shows benefits to academic performance if you do include that physical activity, especially throughout the day. My other concern with some of these mandates and these choices, and it depends on how they're applied, is the actual minutes that translates to, depending on the program, can be really limited, because that might include getting everybody together, if they're dressing out, the change into dress out, the come out to the field or area and get together. They end up with 5 or 10 minutes, because then it's time to go change again. So we have to think about those in practical terms as we're comparing between programs and as we're applying.
I have a program that's in one of the poorest schools in the state in Mississippi. That principal looked me in the eye, and they also have been on conservatorship because of low test scores. And she looked me in the eye and she said, the only way that we're going to get test scores up is if these children have physical activity every day.
Yeah, I just like double.
So I'm Dawn Wilson from the University of South Carolina, and Russ Pate and I recently have published a policy brief. It's also in the Translational Behavioral Medicine Journal that reviews all the evidence showing the increase in academic performance across a number of studies now based on physical activity, because Janelle Christian-Morphy, who runs the HELP committee, so she develops all the health legislation on the Hill, has asked us to put these briefs together. And not only that, we included evidence on improving cognitive functioning, as well as executive functioning, decision-making, which influences behavioral outcomes, and self-regulation, which is extremely important in moving into adulthood, the self-regulation skills. So there is a growing evidence base of literature now that we're really getting out there, and that's on the Society of Behavioral Medicine's website. It's available to the public.
And as it transfers over to Ed, I really appreciate those kind of efforts. And I think that physical activity would have more solid research. Dietary, there is some research there, and it's emerging, and we need to continue that focus, especially for things like breakfast in the classroom initiatives, to make sure children have that breakfast in the morning and the advantages for cognition throughout the day. So we need to advocate.
I was just going to comment in answer to the question that was raised that, if we think of a policy as being a statement of intent along with an instrument to bring about that intent, we can say maybe the government's on board from an intent point of view. Even the example Scott just gave is one where if a government says you're required to do it, but then doesn't fund anything to allow you to do it, or then essentially it's a resolution. They're saying it's a statement of intent. So if we're serious about it, it means that we're going to find some kind of policy instrument and put some resources into it and then enforce it, monitor and enforce it in some way. It doesn't mean it has to be a regulation, but there has to be something that brings it about. I think that somebody asked a question in the session before, and Don just reinforced that one of the ways of perhaps getting more commitment around this is to start to tie it to the outcomes that the educational system inevitably will put first, because that's what they're there for, at least they believe. So we have to use that evidence, and we have to find ways of really having people behind it, not just say they're behind it.
I strongly support that. And as you were speaking, that was my first inclination, is as we move forward, we have to have that evaluation piece built in. That it's so important that in academics we teach, evaluation, and as practitioners we incorporate evaluation even when it's not easy or funded, so that we have the foundation to be able to advocate for more.
I just wanted to go back to something that you had mentioned earlier. You said that parents of obese kids tend to kind of like disconnect themselves from the fact that their children are obese. Do you have any information about how parents kind of react to children with other illnesses or diseases? And is that similar or different from how they treat kids with obesity?
I don't.
One thing about, there's one study, and this is in adults, that obesity also operates differently than other kind of marginalizing characteristics, in that the process you were describing about how parents separate also goes along with adults who have weight problems themselves. They're not as willing to get together with other people with weight problems to get support. They tend to apply the same kinds of biases and stigma against other individuals with weight problems that somebody might against them. It's not a characteristic or a condition that brings those folks together. And like I said, I've only read one study on this. I think it was out of Kelly Brownell's lab. And when you think about the implications of that, because one of the best ways to incorporate physical activity in your life, I mean, how many of you need peer pressure, to go exercise, to go be active, to do something? For individuals with weight problems, start a walking program and find somebody else who wants to. But if you're pushing those folks away or disconnecting yourself, it's going to make those interventions even more difficult. So it's and again, I don't know if those findings still hold today. I think the study is probably 10 years old, but I do talk about that as what makes the intra-group dynamics different.
But I would say, there's a question. But I would say that with the stigmas, the social stigma with obesity is a very unique thing. That if the other groups, other medical conditions, there are a lot of support groups for parents with a child with a variety of, and there doesn't seem to be a social stigma associated with your child having that medical condition, whereas it is a different situation with obesity, and a parent support group probably wouldn't be as comfortable for a lot of parents, I would think. I don't know. Is there? I think there's some disagreement there. That's interesting.
Well, I would say that if you have a child with HIV, that's going to be different than if the child is born with something that,
Cystic fibrosis,
the child
right?
is not to blame.
Right.
The parent.
That's interesting. Oh, sorry.
Just really quickly, and I'm not familiar with this literature at all, but I would imagine that in a situation where you have a peer that you seek out and one of you is successful and the other isn't, that might be very challenging to maintain a relationship. And I assume that's the same with a parent who maybe sees other children successfully maintaining or growing into their weight and others aren't. So that would be, I think, would be very challenging. But I don't know.
follow-up to that, and that is, so one of the things that we're working on at the University of South Carolina is a positive parenting program for weight loss in African American families in particular. And what we're finding is that there's a strong literature that's developing that shows that shared decision making and autonomy support are extremely important, especially for adolescents, in terms of helping them successfully lose weight and keep it off and change their health behaviors.
Are you talking about shared decision-making within the family? Or
Between
with
the parent
par-
and the child.
Okay.
Yep. We teach them specific communication skills, and it interacts with our outcomes and showing better outcomes. So.
Nancy Schaefer, University of Florida. I'm glad I've let these guys go because you're all kind of related. I'm going to take us off on a tangent. Dr. Owen, do you know of any public school programs that are emphasizing physical activity in disabled kids who have a high incidence of obesity and overweight?
I see titles as I read listservs about studies that came out, and since that's not my area, I tend not to read the articles, but I know there is data on that. I just haven't followed the literature with that. But yes, that is looked at, and there is research on that. I'm just not familiar with it.
So for, let's say there's a teacher who's kind of in a school who's like, school system doesn't necessarily support or have something in place to increase physical activity or nutrition. How could a individual teacher kind of bring that into the classroom first?
I think my sense is teachers have a lot of leeway of what goes on in their classroom. So even if there's not a district-wide or school-wide or even principal-initiated emphasis on physical activity, I think teachers on their own can incorporate physical activity into their academic lesson plans. So even without a policy statement, I think teachers are oftentimes free to do that sort of thing. Now, if there's research on that, I'm not sure, but that's my sense of it.
I have a colleague at the University of Missouri, Steve Ball, and he's an exercise physiologist, and he has an extension appointment like I do, regular research program and extension. And he works with schools in the state of Missouri to implement what he calls brain breaks, and it's a classroom level intervention. Well, it's an intervention, but it's not been evaluated per se, but it's the idea that you plan intentional activity breaks during the day. And like what Scott was saying, that's something that an individual teacher, independent of any kind of policy in the school, could actually do. So like you plan in your mind every, 20 minutes or 30 minutes, you're going to have the kids get up and, reach for the stars, kind of like what we did today during the session when Sherry led us just to do some physical activity. So I do think that there are ways teachers, I think teachers who have keen observation skills can actually anticipate when it would be worth doing something like that, because I do believe it helps kids regain focus, and get attention back. It's like kind of in line with what you were saying with about the academic achievement. So I think there are ways that teachers, the food side I think is a little more tricky.
And I think there are actually a number of examples. I can think of a handful of examples of programs that I've seen presented and published that actually started with a teacher. So often if they are in a community where there's not that top-down approach, they have actually taken the initiative to develop something for their classroom and then help expand it out. And I've seen just about 3 or 4 small publications on that. So teachers, yes, they can make a huge difference.
I had a question for Dr. Colby. How do you keep the children engaged in the intervention for such a long time after the initial 6 classes were over?
It's been a real challenge. We do have the online fun activities, and it's interesting. I'm surprised nobody has brought this up yet. Now that I'm back, because I say online, because sometimes we get pushback saying, "Okay, you want them to be physically active, and you're putting them online." And I think the concept there is that we don't think that we can completely remove the online environment from their life. But what we can do is hopefully replace, not add on time, but replace some of that time with something that's got a health message. So they are online anyway. They're developing friends. They're developing relationships. We also do have the booster activities that they see each other in person, and they play at the park, and they play in different community locations, and a lot of kind of each state gets to make videos about their boosters, and they all get together and do songs and dances, and then they can see what their other, because we do all the boosters at the same time between the states, so they may look for the next, the other states to see what they did that time, and we try to keep them engaged as much as we can. One thing that I will also say is we've noticed there's almost a dosage effect that's naturally happening, and that you have some children who are very engaged after that 6 classes, and they love the online, and they're posting constantly. They're always making videos, and they're really exciting. They're so much fun to see. And then you've got some that are my students call creepers. I'm not sure, because they go online. They're not going to post. They don't want it, but they're watching what's going on, because we can see behind who's using what and what's on the page, and so they're still staying engaged, but in their own way. And then we have some that are just they're not online. They haven't posted as many videos. They're not staying as, so we need to do some pretty advanced analysis to try to be able to look between these participants to see if we have different outcomes. And that said, we are just now reaching out with a new arm, and that we are going to take what's put online, and we're making newsletters that will come out monthly as well, so that they will be receiving the same information online and by newsletter, to see if we can engage some of those students who are currently not, or some of the participants who are not still online this many months out. And so we'll be watching also to see if that pulls them back into the online environment to interact. So we'll be reporting on that as well.
Something that wasn't talked about specifically in any of the lectures, but that was kind of mentioned at, was the implication of childhood obesity on like overall human capital. Can you speak to that a little bit, and kind of what is lost, both knowledge-wise, but just socially too, with human capital?
So I'm not
We could do a conference on that.
Yeah, I'm not an economist, but I like to use the expression human capital, and the definition of that is basically the characteristics and knowledge and skills embodied in the individual that allows them to go on to produce some sort of tangible value. And to me, why that is relevant is, when we look at when I talk about that in one of the classes I teach, I talk about it from the perspective of what happens to adults who've lived with obesity for a long time, in terms of some of what we know about the workplace, and some of the ways in which adult obesity can affect, it affects different things in the workplace, but it does, there could be more missed days of work. Obese people are less likely to be hired. There's some really very provocative research from social psychology about that, about what happens in the interview environment for a person who is overweight, and how they may have the same skill set as another applicant, but that they're less likely to be hired. I'm trying to think of all the different ways I talk about it, and in adults. And so it's this idea that adults are less likely to be promoted in their jobs if they have a weight problem. There's this whole constellation of factors associated with employment and education in adults who are overweight and obese. And so I link that with what we're seeing that's possibly happening in children who are developing weight problems early in life. If they're not achieving as well academically, that could be a barrier for their future educational success. There's some research from, I think it's either the 80s or the 90s, that showed women who were obese during high school had fewer years of post-high school education in their early 20s compared to their non-obese counterparts. There's quite a bit of cross-sectional work looking at that as well. So I look at it from the standpoint that some of what we know is important as far as having a job, well, first getting post-high school education, completing that, developing a skill set that's going to allow you to be employable, having a skill set that can grow and expand and develop. Some of what's happening to children might interfere with that if they're developing weight problems early in life, especially, and this isn't my area per se, but it's not hard to kind of connect the dots. If they're developing significant like precursors of chronic disease, that's going to affect their ability later in life as well, because we know that what's happening to children, particularly in the obese category and probably in the like that 99th percentile and up, or 97th, some of what's happening inside their bodies is setting them up for chronic diseases. And we know that living with those chronic diseases probably interferes with some of what goes along with human capital formation as well. So does that help? Because that's kind of how, I mean, it's sort of, it's not a research perspective per se, it's more connecting the dots between different areas of research. And in terms of, if this is what happens to adults who've developed weight problems, we know obesity tracks from childhood up into the adult years. And so is that what the future potentially holds for these kids? So that's kind of how I think about it.
And I'll actually take it even a step further and not specifically research. My mother, when I was starting off undergrad and moving forward, used to call me Cassandra, the prophecy of doom, if those of you who remember, I think, Greek mythology. I know, right? Because, but at the time, and I'm glad that I was over prophesizing, but I was very concerned at the rates with obesity and then diabetes. And working as a clinical dietitian, I was working clinically when we first started seeing children with type 2 diabetes. And the impact that had on me, you know, watching, and I actually worked at the Cherokee Reservation. It was my first clinical experiences, and it was a wonderful community to be a part of, and such a complex picture of the development of obesity and diabetes and how that process happens. And so looking at the numbers increase with obesity and looking at the numbers increasing with type 2 diabetes and the age at which people are being diagnosed, that if you look out 20 years, if somebody is young when they're diagnosed and you're looking 20 years out at the workforce and you're looking at percentages and you're looking at possible complications, and we already have enough trouble keeping, you know, our healthcare system afloat in some ways, and imagine with dialysis and amputations and blindness, and you're losing people from the workforce, and you're increasing the need from the healthcare perspective. That's why I got called Cassandra, because I have real concerns. So I think that there are potential real problems down the road.
I have a question, because it's come up several times. You brought it up a minute ago, and then it was in the last presentations. And it's this whole thing about technology, because this is, you know, a technology generation. You're all speaking to these kids in school. And you know, I think back, I actually was around before Title IX, so I'm really aging myself. And those in the room who don't know Title IX, it meant that women had no sports in school. And we weren't equal in that sense to guys. But we went outside. Everybody went outside and played. And so I really would like to hear what each of you think we need to do to be able to get these kids physically active, but do it. You've barely touched on it. I'd like to see you tell us more about what could be done with technology, because we can't tell them don't get on that stuff, but you know, and then there's the Wii, you know, where are we with, you know, that looked really cool there for a while, but we don't hear a lot about, you know, playing the Wii at home and all that. Maybe it's still going on and my kids are too old and I don't know it, you know, that type of thing. But I'd like to hear from you all what you think about technology and how we can get this up and, you know, physically active, but do it through technology.
This is so funny, because this is not research. So I will turn this over to you in a minute. But I have a 14-year-old and a 16-year-old who are techies. Techie. I hear about everything that's cutting edge all the time. Could you see my eye roll? I'm not sure if you could. But there are the new things that are coming out. This Oculus Rift if you've ever seen it. If you Google some of they have older adults using the Oculus Rift for the first time. It's very funny. So it's goggles that you wear that put you in the virtual reality, and then they're developing. Oh, and I can't remember because they've discussed a lot which one is winning, who's doing better, and the development's doing well. But basically, treadmills or type bubbles that can move in all directions. So and then you wear a belt around the middle. So the development is moving very rapidly with these new games to where you will physically be standing and running and wearing these things to where it looks like you're in this world. And and the amazing part is it's because I'm like, and then I'll start looking. It's not that far away in development. So it's the jump from the Wii, which they all thought was kind of cool, and then it's over, But not over. Sorry, do I get in trouble as Wii representative? But the new things that are coming along are the kids are aware of it, and they're very excited. And I think there's some real room for some physical activity involved in what they're interested in. Yes, definitely. Sorry. Okay, go ahead.
Yeah, extra gaming and interactive video games, whole body movement video games, that comes under the category right now I still think of potential. For example, we published a study about the Wii. In Oxford, we gave the Wii to 8 families for 3 months to see if they would use it and had pre and post measures on the Wii. One of the main findings was how incredibly sharp the drop-off was in use over time. Between the first 6 weeks and the second 6 weeks, there was an 82% drop-off in minutes of use. So, but I'm not ready to give up yet on extra gaming as maybe having some real benefit. There's so many games that come out so fast. It hasn't shown itself yet to be really important, I think, in raising the activity level over time, but it still might. But right now, I can't say that I've seen evidence that it's going to be one of the solutions or much of a part of the solution. But maybe there's still a lot to be done with extra gaming, whole movement video games, because there's so many things coming out that are so attractive to kids. And if it can get them moving rather than doing this, the jury's still out on those sorts of things, I think.
I really don't have, I have like a cell phone and a laptop, but I don't have a TV with TV on it, and I don't play video games, or we don't. I would like to see more emphasis on the outdoors. I truly believe that that's where physical activity is going to happen. I understand the whole technology thing, but I have, just because of community volunteer work and stuff, work with a lot of low-income families, and those things are so far off. It's so, and I really, I don't know, I just, you can get really philosophical about this, but, when you think about income inequality in this country and how things are happening to families, I really feel very committed to the low-cost, low-tech, outside-the-door intervention, but I don't do any of that. This is just, like you asked for our thoughts, but that's how I think about it. Like, I think about community gardens, I think about school gardens, I think about school playgrounds. I mean, that's my favorite place to take kids to play, is school playgrounds, and just ways, to kind of return to something. I don't think technology, I was telling someone earlier, next semester I'm implementing in my classes no more laptops, no more handhelds, no more technology in my classrooms, because, it's frustrating to no end, number one, and number two, the research is coming out. There was a New York Times Science Page article about what we're learning about the difference between typing information and writing information. There's a great Chronicle for Higher Education piece about how a faculty member presents this to the student body in the class. This is why I'm not letting you do this anymore. And, I just, and call me whatever, I know it's not sexy to not be techie, but I'm not. So, but I really believe the outdoors, for me, that's where it's at. So, Dawn has had her hand up for a while. Right.
Just a couple comments. One is, I don't know how many of you know Tom Bernowski, but he's been doing these trials for a long time on technology-related games, and he actually has a journal now. He's the editor, is a journal of health games. Games for Health is the journal. So he's really taken this on as a big area. Although I recently he gave a talk at our university, and I do think the evidence it's not strong. I mean, I think there's some evidence, but again, I agree with you. It's not strong. It hasn't really come across as the earth-shaking, I think, landmark sort of thing. The other thing I wanted to mention is that, so I've been working in this area of school-based interventions for a while. Russ Pate and I had a large trial that I was the PI on called Active by Choice Today. We also have a follow-up study now. What we're finding is that what really motivates kids to be active is social relationships. So it's the social context that motivates them to want to be active. And now this trial that we have coming up is going to be looking at specifically what those social mechanisms are for boys and girls differently. So.
Yes, I definitely agree as it relates to the technology standpoint and getting to what Dawn said about I think one key that we're missing with technology is that we're not interacting with each other, and that's one thing that younger kids, being from a developmental background, they can't develop those social skills of, can we play together, cooperation and figuring out things together versus in the tech world where it's really more singular when you're by yourself. And then, of course, the novelty. After about 2 or 3 weeks, or like, Scott said, about a 6-week period, regardless, technology has changed, and then also their attention towards it. This is old. Let me throw it off to the side. But I agree with Sarah, just going back to the basics that all of us did as children and going outside to play and playing with a friend is, I think, some of the key factors that we might have to get back to, and cost effective.
I'm going to play devil's advocate here for just a minute. And then maybe I'll have time to explain that I really do want to be outside too. But I think it's very important. It's very uncomfortable for us we grew up in a different way to watch this new generation. I reflect, and I don't think it's this extreme, but when books were first printed, the older generation said, you're going to ruin your world. You're going to ruin your life. You're ruining your eyesight. You're ruining your mind. And there were many people who were very upset that you were no longer communicating, you were no longer doing all of these things, and it was the downfall of mankind. I spent a lot of time dialoguing with my kids in terms of what is the difference between actually experiencing life, going out there and feeling and playing in the woods and being with people physically. Because I hear they're downstairs, I hear them playing. It's interactive. It's completely interactive. They're dialoguing with people from around the world on social issues, and while they're playing games, they're building worlds. It's very user-generated now. I mean, the Minecraft, which just got how much money? My kids started playing that when it was beta, before anybody had heard of it, and I've watched that grow. So I think that it's easy for us, and my mother's in child development, so I've always had concerns. We don't know. So I'm not willing to jump to that side to say it's not valuable, it's not relationship building. It may be in a new way that we don't understand yet. And it may be equally important, especially if you get into bullying and all of these things and developing these social relationships. And it's a new world out there. So they have a life online for a lot of kids, not all. And it's something that I think we have to be very aware of. And I'd also say, because technology is moving so quickly, if we discount things, we're not ahead of the curve. And in 5, 10, 15 years, if we're as health professionals not ahead of that curve, we're going to be behind.
Hi, I'm Danielle Schaffman from South Carolina, and I just wanted to add a couple of things. So one is that there are these very cutting-edge technologies, but there are also a lot of very low-cost and easy-to-implement ways that we can continue to use technologies. So I think it's kind of narrow-minded maybe to discount all technologies based on sort of the extreme versions, and as intervention tools, I think they hold a lot of promise. And the second is that I've done some work looking into the content of a lot of commercially available apps and the efficacy of devices that are being marketed. And I really think that we have a place in trying to insert ourselves and our expertise into this market, and just ignoring it is really we're being very neglectful to the public because people are purchasing products that they think are health promoting but really have very little science to back them up. So we have to find ways to collaborate with industry, kind of whether that's the traditional model or really the way that everyone wants to go. I think some of us need to find our way into that market. So.
And I just, to qualify my answer earlier, that was me, Sarah, with my Sarah hat on. That wasn't me with my professional hat on. So, but I agree with you that ignoring this whole area is far more costly than buying into it wholeheartedly. There's got to be a happy medium. But for me, it's never, I mean, I don't do Facebook. I mean, does anyone else in the room not do Facebook? I mean, okay, a couple people. Yeah, I mean, like, I do feel kind of weird that I don't, but it also just doesn't serve my needs, and I'm also, you know, more introverted than not, so whatever. But yeah, I think you're absolutely right,
Yeah,
that we cannot, as professionals, ignore these things.
And there are a lot of, like, very proven psychological effects of video games that, as like the modern world evolves, there's research to show that people are not having the same sort of fulfillment from their everyday lives in ways that they can find through video games. So I think it's sort of a way that we have to step outside of ourselves and what maybe we would find fulfilling, or, you know, methods that we would find easy to implement behavior change and kind of understand what's actually happening psychologically that we could benefit from.
I'll actually, oh,
Just wanted to comment about something Sarah Colby said, that you made me think about the monks, you know, the monks who spend all that time copying the Bibles by hand. You know, that was the technology of the time, but if they spend all their time doing that, they weren't physically fit, right? They weren't moving their bodies. I guess my comment is, I think that we have gone quite far in denying our biology and denying the biology around us, which is why we're so cavalier about the physical environment. So I think everything you said, Sarah, was fine, but in the end, we have to move, right? If we don't move our bodies, then we're not going to be healthy. And so if the technology helps us do that, fine, but a lot of the technology, in fact, is doing the opposite.
I agree. And I'm hopeful that it's going to change. And watching some of the cutting edge, I think it's possible we may see it change.
Okay, I'm kind of staying away from the technology because I know it's been kind of a common theme, but one of the things that I'm really interested and passionate about is these new, it's kind of like food deserts where these lower socioeconomic classes don't have access to fresh produce and fresh things like that. And I know, Dr. Colby, you mentioned in your programs you weren't available to reach all the students that you were really hoping to because they don't have a guardian that can participate in the program. So I was just wondering, through your workshops and things, do you focus on items that may kind of fall under the WIC or government assistance, or what is kind of your area of focus for the culinary workshops?
Yes, we definitely do take into consideration the USDA's thrifty food plan and picking items that would be under the WIC plan and so forth. I think that there are also lots of novel, wonderful community efforts being made to overcome some of the food deserts. And again, I'm very hopeful. I tend to be a very optimistic, hopeful person. And I love seeing some of these things happen. And we don't have those incorporated right now into iCook, but I think we definitely could. From I was just reading about a wonderful program at schools where they the children actually develop not a food bank. Help me out here, like a farmer's market type. Right. Yes. Yes. And so there can be some really unique ways that could be incorporated. You know, from the food trucks that can come around into neighborhoods that have fresh produce to, you know, some out of the box thinking to help, because we really do need to be aware of the food deserts and food access issues.
That brought me to a question that I had while you were speaking today. We hear that cooking skills are being lessened. Is that necessarily in lower socioeconomic? No. And then also the other piece of conventional wisdom, and I'll let you speak to this, is that maybe one of the reasons why is because of taking out of home economics in
economics.
schools.
Yep.
Is that, would y'all agree that with that conventional wisdom, is that that's probably one big reason?
A loss, definitely. The home economics from schools was a real loss, and it's so interesting because there's so many kind of gender inequality issues around that that history of what home economics, people's perceptions of it, and then reasons why it was not supported, and how to reintroduce it to where it is gender neutral, and everybody sees it as life skills as opposed to some
Women's work.
yes.
Yeah. You know, I liken it to maybe when I first started teaching, all of my students had 3 years of high school home economics, and so I mean I'm old, so it's been but I liken it to teaching calculus to somebody who's never had math in school.
Well, I'm one of those old home ec people. I have 2 degrees in what was called home economics education. And so it's now called different things. Family and consumer sciences is the most prevalent name for it. And there still are schools, particularly in the South, who have teachers. But the issue is getting young people into education, period, much less family and consumer science education. And so we keep seeing that resurgence of talking about the loss of home economics in the media. And I think when you look at what's happened in education, the loss of the arts, the loss of physical education, and the loss of home economics. I evaluated an intervention that was done by a regional university in far eastern Kentucky in Martin County, which is as mountainous as you can get. And we did a social network analysis of middle school students who were involved in the intervention, who actually identified who were the champions in their school for that. And we also surveyed the teachers. None of the teachers identified the phys ed teacher or the family and consumer science teacher as being champions for their health and wellness, but the children did. It was statistically significant that the kids identified those 2 teaching positions as being the champions in their school for it. And that was pretty eye-opening, really. It was eye-opening for the faculty because none of the faculty identified those 2 positions. So it was interesting.
And as the microphone transitions, I'll also speak to the socioeconomic status and the cooking skills. This has not been researched, but it definitely should be, so if anybody wants to pick it up. That I think that we haven't so far talked about the difference between from scratch and what counts as home cooked. And one of the major barriers for a lot of people's time for cooking is a barrier. And also energy and motivation, and how much energy you have at the end of the day, and all of those internal motivators. If somebody has higher income, they can buy foods that are already half prepped or mostly prepped. You can, it's such a luxury to buy chopped items, that are ready to throw into a skillet. And so that's where in terms of cooking skills, and that you can overcome a lot of the cooking skills if you can buy higher end items that are already mostly prepped, and you make a homemade meal. So that it's a complex subject there.
So just another question about the iCook program. I know that you focus on meals and cooking meals, but I was wondering if you focused on how to prep a quick snack instead of grabbing a bag of chips or instead of grabbing a cupcake, because those are so easy to grab. But if you practice maybe cutting cucumbers and having a side of ranch or something like that, along the lines of that.
We definitely have the skills to prep the snacks. We actually have some of the earlier in the assessments, we have snack type, easy to fix, quick items, so the kids are still having hands-on experience. And we discuss snacks, but there's not a focus in terms of culinary and preparing snacks. I think the closest is there is a smoothie lesson that's very much, we talk about after school, and they do a green smoothie with spinach that they love, that's phenomenal, and then they can make all sorts of great things with it. So we have a little bit, but not a heavy focus.
Last question. a lot of pressure on you. Don't feel pressure. Last question.
No, I wonder if there is any study about the intra-household food distribution, because there are I have seen a lot of international studies related to that. If especially in the poor community in the household, they have limited budget to buy foods, and how that is being distributed among the members of the family, because it is a highly discriminated in many society. But is there any study in U.S. For a household?
So are you,
Like how the food dollar is being
Yeah.
distributed among members of the family?
Within the family, yeah,
well,
intra-household.
it actually, Ed Frangillo, would you know about that question from the food insecurity perspective about households with, I mean, the only thing that comes to my mind is I have read that in single female-headed low-income households, the woman frequently takes less to make sure children have more, but that's the only thing I've read or seen, and so I can't answer in any more
Yeah,
comprehensive of a way.
And
I have
yeah,
read
Ed is an
international
expert.
studies. Is that is a
It is also in the U.S. I guess is the answer.
yeah.
Yes, with food insecure homes in the U.S., it does follow the same pattern. That parents are the first to start cutting back, and then having to miss entire meals. The children are definitely the last to go hungry.
Yeah, that's,
Yeah.
It was about 5 or 6 years ago, we started interviewing children because we realized that everything we thought we knew had come primarily from mothers, some from men. And children basically tell us the same thing the parents do. Children tell us that they're cutting back. They don't want their parents to know they're doing it because they know it's important to their parents to believe the myth that you just cited, that parents see it as their responsibility. So we don't want our parents to feel bad because we don't have enough, but I want my younger sibling to have enough, so I say I'm not hungry anymore, even though when I am. So it's actually complex because people in the household are playing out different roles. I think, as the comment was made, in some societies there's definite preferences for men over women and children. In some cases, there's preference for women over. So it can vary certainly by context. I would say that I hear a lot of talk about, we know all about intra-household food distribution. In fact, the empirical research base is really, really thin, not only in the United States, but elsewhere.
That was my question. I know we have to go, but what do you think? Because Ed really is the expert on this. What do you internationally? Do you think that may also be an illusion that we've had for years, or do you think that?
No, I have read some of the articles. They have shown that there is a clear discrimination against the girl. Even within the child, there is a discrimination against the girl child versus male child. So if there is a limited, the first person will eat less is the female, adult female. The second person will be the male household head, and third will be the girl child. That is how they categorize based on the priority, because they have evaluated based on the average consumption rate within 24 hours and take many samples on that. Based on that, they really, I read those articles based on not the actual calorie intake, was how they have distributed that food. So that is how I see in the international journals, but I have no idea about this.
Well, that was an awesome last question. and thank you to our speakers again.